Hi, everyone. Welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today I am welcoming Kelly Herbert, who is the COO of our company. Welcome, Kelly.
Thank you. And today we're going to be talking about GLP-1s and the effect on your face. So, Dr. Ladner, GLP-1s are everywhere right now, but what's actually happening to people's faces when they lose weight so quickly?
Yeah, so we've seen this historically, whether it's GLP-1s or just folks that decide to proceed with a healthier lifestyle. So rapid weight loss with diet and exercise, or now obviously with the increased popularity of GLP-1s, we're obviously seeing a lot of this. And the issues that arise, obviously, is with rapid weight loss, we are now seeing changes to the skin, changes to the underlying deeper tissues, as well as just volume loss in the face, which is obviously leading to increased demand for the procedures that we offer in our practice.
So, can you talk to us a little bit about what changes are happening? Is it changing the muscle structure? Are they just losing fat? Is the skin kind of looks like it sags a little bit? What's happening there?
Yeah, that's exactly right. So really depends on where the loss is occurring with respect to the volume and the fat. There are multiple fat pads in the face, at least 12 named fat pads within the face. And then that doesn't even include the neck, which has multiple fat pads. And so depending on where that weight loss occurs, which typically is going to be widespread throughout all of those fat pads, it can do both. So we can get stretching out of the skin when people gain weight, stretching out of the muscle if it's a deep fat pad. And when that weight is lost, now that skin and or muscle doesn't have the elasticity to snap back and get back to that appearance that they're used to.
Got it. Okay. So talk to us a little bit about when patients come in and they're saying, gosh, I'm too young for a facelift. I'm in my 30s or I'm in my 40s. I'm just too young. So what do you have for non-surgical options? And I know I've heard you talk to them about why filler and or other non-surgical interventions may not be right for a longer term solution.
Yeah, exactly. So there's no perfect sweet spot age for facelifts or fat grafting, which we'll get into, which is a really nice way to revolumize faces that have lost that volume using a patient's own fat. It's their own substance. So it's not that filler can't work, but the issue with filler is that it's not long lasting.
Okay.
Versus fat grafting, right, which is in theory going to stay around forever. And the other thing is, if you looked at all the fat that's lost on these GLP-1s, you'd be talking about 10, 12, 15 syringes to replace that volume, right?
Got it.
So if you're doing that every 6, 9, 12 months, that adds up to a lot of money.
That's more than the cost of a facelift almost.
That's
right?
exactly right. And certainly more than fat grafting, yeah.
Okay, so let's talk about fat grafting. So you said fat grafting is more permanent. I know that's not our main topic today, but if I've lost a bunch of weight and I've got some of that sagging, could fat grafting alone fix the sagging face, or might I still need a facelift if I had loose skin?
Yeah, exactly. So you hit the nail on the head. So you're going to need both. So as we know, we've talked about in this show multiple times, a facelift does just that. It lifts the deeper structures of the face and neck. So we're tightening the muscle, the connective tissue layers in the face and the neck, and then the skin glides along with it and we remove that extra skin. But if you think about a facelift, it doesn't actually add volume to the face.
Okay.
And typically with the GLP-1s, we're really having to deal with both, which is that skin and that muscle has stretched out, but we've also devolumized patients. So in general, to get the best result, we need to replace both.
Okay, and I know I've heard you talk to patients about really when we're trying to lift the skin and the muscle structure back into its youthful place, that there really are not good long-term non-surgical interventions. But I see a lot of TikTok videos, Instagram videos about gua sha and facial massage, some things about filler, but now you're seeing all of these other I don't want to call them gimmicks, but procedures that promise to give you a facelift-like result. But is there really anything like a facelift out there that's not surgical?
Yeah, so unfortunately or fortunately, not yet. So I've been doing this for a while now. This is the 15th year that I've been in my own practice, and that doesn't include the 6 years that I was doing surgical training before that. And every year, every 2 years, I see this time and time again, there's a new device that comes out and they say, okay, finally, this is it. This is going to replace the facelift, right?
Yeah.
We hear this every single time. And what happens 2 years ago, you don't even hear about that product anymore because it overpromised, it underdelivered.
Got it.
So we really don't have that technology. Someday we might, right? But quite honestly, I've seen very little progress in the non-surgical alternative modalities to tighten faces. And, each one of these devices may work differently, but time and time again, it really doesn't offer a whole lot of results compared to the standard facelift. And what I hear in my consults all the time, and just yesterday I heard this, was, hey, I spent $12,000 doing a non-surgical, multiple non-surgical options to try to get a nice jawline contour and take care of the double chin. And she said, quite frankly, 5, 6, 7 of these treatments, and I didn't see a result with any one of them. So all different modalities and no results.
Got it.
Yep.
Okay. So is the GLP-1 face reversible without surgery, or can they do other things other than gaining all the weight back?
Right. So it really depends on age and elasticity of those tissues, the connective tissues, the muscles, the skin that we're all tightening with a facelift. So that's issue number one. So if you're 30 and you've been overweight for 5, 10 years or maybe less, and then you go on a GLP-1, we can expect that skin's going to do a pretty good job of snapping back. That muscle's going to do a pretty good job of snapping back. That being said, though, sometimes it's really a shock to the system for our patients, because even if that skin snaps back, they look at the volume, they look at the contour and the shape of their face because they're used to being filled out, and they may not like that look. And so we're still talking about permanent solutions to revolumize the face.
Right. And I think that volume loss is one of the things that ages people the most.
Exactly.
Right?
Yeah. My running joke that I've always said, it's a terrible joke, but I always say, if you want the cheapest option to look really good in your face, just go to 7-Eleven, buy a bunch of Twinkies and just start eating them. And you might not need me, right? And,
yeah, there we go. Might not be cheaper, might not be healthier.
Half joking, but it fills out the face. Or overweight peers, right, that we all know, they tend to look a little bit more youthful in the face because fat and volume stretches everything out, and it fills in those lines, and it stretches that skin out, and it can look nice. Trade-off is that you're not necessarily happy with the rest of the body.
Right, got it. Okay, so but what I'm hearing you say is there is no right age. It's based on your individual situation, whatever that might be, whether you've used GLP-1s, or you've just worked towards a healthier lifestyle, and you've had significant weight loss in a short amount of time. Come in and see us, have a consultation with you, and let us decide what the best surgical approach might be for that.
That's exactly right. Yeah, when during the consult and even before the consult, patients obviously have considered, they say, is this a big enough change to where, yes, a surgical procedure that will address this absolutely is justified, rationalized, because I'm going to see a result. And so we don't go by the age, we're going to go by, are we going to be able to actually make a dramatic enough result that it justifies that procedure in downtime?
Got it. Well, that's all the questions I have today. Thank you so much.
Thank you for being here. If you guys liked what you heard today, please be sure to like the video and subscribe to our channel.